is Paget. So Rekha, Shweta, and Rajni is there. Shweta, Rekha, I noticed.
ma'am.
Rajni, I have not noticed. Is she there?
Ma'am, I'm here.
Okay, no worries then. Three cases, half hour actually. Okay. Uh, Nobody posted today actually.
So, ma'am, for the next week?
No, today means five cases, na? See, we were about to do three cases today, but two more cases we were supposed to post for this week.
Okay.
Okay, ma'am. Okay, ma'am. We will
Can I
post.
post? We will post. Ma'am, so it works like this that whatever cases we are having difficulty, we can post and then you will be if
We
Whoever
will be, yeah,
present,
yeah,
yeah.
yeah.
Hmm.
The one who will be posting will definitely miss. I think we should give them a chance to present so that
okay.
their confusion, their ideas get cleared regarding that.
Okay, ma'am.
And uh, different cases which will channelize our brain and difficult cases. Rajni, we have already covered the whole Lisa book when we had started after last result. So maximum of the audience were there, but still we will do it very fast, very quickly. Okay, today.
Okay, ma'am. Thank you,
Hmm?
ma'am. Thank you, ma'am.
Yeah. Two cases, Sunday or Monday. Sunday, most probably. We will see whether we will able to do it or not. Okay.
So, ma'am, do we have the recordings of the sessions of the Lisa which
Yeah,
had
the Uday is actually sharing a few recordings. I do record. Uh, but the previous recordings will not be there. Means those were we just started it as an activity, just a routine activity to how to go ahead and what to do. So at that time we might not be having few task recordings are there. Now onward we will see to it that every task will be recorded properly. So Rekha, are you ready?
Yes, ma'am.
So I will be starting your 2 minutes time. Just let me check whether I have started recording or not. Recording has started. Yeah.
Ma'am, can you share the scenario, please? Ma'am, next, please. Okay, ma'am. I will start.
Not have completed your 2 minutes.
Okay, sure.
Take advantage of your 2 minutes, okay? So that you will
Yes, ma'am.
compose yourself.
Yeah, okay.
You can start now.
Hello, I'm Dr. Rekha in the clinic. May I confirm your name and age, please?
I am Sarah Smith. I am 48-year-old.
How may I address you?
Sarah is okay, doctor.
Sarah, please accept my apology. The clinics are already running late. We are working on that, and my consultant is busy with the audit meetings. Can I continue the consultation on his behalf?
Yeah, doctor, actually, they rushed me and it was very busy. I was really irritated with that. But now you can continue. Already fed up of waiting for so long. Yes.
I'm really sorry for that. How are you doing today?
I'm better off.
Okay. I can see that you are here to discuss your results. Before that, can I ask few questions? Then we discuss your results and further management plan.
Oh, yes, doctor.
Can you tell me more about your itching?
Yeah, actually, I have started having this retching on my vulva since last 6 months, and initially the GP has been given me some steroids, and
Mhm,
it was been little bit relief, but then it was not going completely, and then he
mhm,
decided to go ahead with this biopsy. He has arranged it, so
mhm.
after that, I'm here. Is there
How
anything
was
to
your
concern, doctor? Because he rushed me to discuss the report. My recovery is fine.
mhm. I can see that you're anxious about your reports. I will discuss in a moment. Before that, a few more questions can I ask?
Yeah.
Okay. So, may I know that have you noticed any change in color of and texture of your vulva?
Not actually, but it was getting not getting properly, and that those lesions which were there, which was from the beginning. So he
Mm-hmm.
suggested that I need to undergo treatments biopsy because it has not responded to steroid.
Mm-hmm. Okay. And any change in your weight and appetite?
No,
Okay. Any problems while passing the urine?
no,
Problems with waterworks? Oh, sorry, bowel.
no,
Okay. Any itching in the other parts of the body as well?
no.
Okay. Any burning, soreness?
Mm, sometimes due to excessive itching, I do have that burning sensation at the same
Mm.
lesion.
Any bleeding and discharge?
No.
Does it affect your way you live?
Yeah, doctor, because it's affecting my quality of life. I need to scratch my vulva so badly, and at the time, it is embarrassing.
I'm really sorry to hear about that. This must be a very difficult time for you, but help is available. Yeah, I can see that your last period was 2 weeks back. Is it that right?
Yes.
Okay. And I would like to ask some personal question. Is it okay?
Yeah.
Okay. Are you with someone now?
I'm married. I'm having 2 kids, doctor. I'm with my husband.
Mm-hmm. Any problems while having the sex?
Yeah, it's very painful at a time. I do run away from that. So it's bothering me also.
Mhm. Is your partner supportive for you?
Yeah, he's quite supportive.
Good to know about that. And your cervical screening is up to date and normal?
Yeah.
Mm-hmm. Any contraception are you practicing?
Yeah, I'm using condom.
Mm, that's good. And any health issues for which you're following your GP?
No,
Any operation in the tummy and down below?
no,
Any family history of cancers?
no.
Mm-hmm. Are you well supported at home?
Yeah, doctor, I told you.
Mm. Okay. Do you smoke?
No, no.
Mm-hmm. Okay. And your BMI is 22, is that right?
Yeah,
Any allergies that you are aware of?
no,
Thank you so much for giving me all this information. Anything else important you want to add?
no. Thank you, doctor. Can
Is
I
it okay
know
if I?
now the report?
Yes, sure. Just I would like to examine you in the presence of chaperone to see the skin of your other areas as well, and skin from the down below to see that the area is healed well. Is it that okay?
Okay.
Mhm. I can see that you are alone. Do you want to call someone? I have to give you a lot of information.
No, doctor, is it something very serious? You can go ahead.
After confirming your name and NHS number, I'm afraid that I don't have the good news. Um, histopathologist has some concerns regarding your reports. Actually, your report shows that there is then abnormal cells in the top layer of the vulva called the Paget disease. Have you heard about that before?
No, doctor, something to worry about. I have not heard about this anytime.
I can see that
Because
you are anxious. It is not a cancer, but it is an stage before the cancer. Most of the time, it involves only the upper layer of the vulva, but in 1 in 4 cases, it can involve a deeper layer as well, and it can originate from the surrounding tissues as well, like the bowel, back passage, water pipe, or breast.
Oh my God. So what does this mean to me, doctor?
I'm really sorry to be bearer of such news, but at this stage, we don't know that either it originates from the other areas or not. So we need to do certain investigations.
Okay. Yeah, yeah, go
Uh,
ahead.
Okay. So may I proceed?
Yeah, doctor.
So some camera test will be done for the back passage and the water pipe and the water bag, and also we do the some special scans like a CT scan to know if there is any spread, and a breast scan will be done, and also we'll take the sampling from the glands, lymph glands in the groin called the lymph nodes. Am I clear till that point?
Okay.
Once these tests will be available, we will going to refer you to the team of the doctors within the 2 weeks, including my consultant gynecologist, cancer specialist doctors, vulval specialist, imaging doctor, tissue doctor, and also bowel specialist doctors will be involved.
Okay.
So, should we proceed with the management?
Yeah, doctor, I wanted to know.
First of all, I would like to advise you some vulval hygiene measures, avoiding using any sands, shower gels, and
Yeah.
uh,
Yeah, that
okay,
has been explained to me by the GP.
okay, that's good. Continue with that, and also some we have the options available in the form of surgery, creams, and the light treatment, laser treatment, and the radiation treatment in the form of radiotherapy. Do you have any preference?
I would not like to have surgery, doctor, because it's such a tender area. I'm really afraid to go undergo the surgery. Um, I would like to go through any medical medicines or any other therapy.
Okay, your concerns are valid. Surgery is a recommended treatment. If you don't want to go ahead with the surgery, we have the options available in the form of the imiquimod cream that will boost up your immune system to destroy these abnormal cells. You will see the effect in the several weeks. By doing this, we can avoid the risk of the surgery and the anesthesia. However, it will not provide us any sample which can be only be provided in the surgery. Am I clear till that point?
Okay, so it's okay, doctor, because you have just came to explain me that this is a condition. So, and if there is alternative treatment available, I do not want to undergo any other sampling because already you had done a biopsy.
Mhm. But yes, your concerns are valid. But it can cause some pain, burning sensation, swelling,
Yeah,
and
that's the reason. That's the reason. It's such a sensitive area. I do not want to do any procedure because with the biopsy also I had a lots of pain, doctor. So I think surgery will not
mhm.
be an option.
Yes, okay. So we have some light and the laser treatment, but it has the more recurrence. So in this situation, they will apply some cream to the area, which makes this area sensitive to the light, and then a specific wavelength of the light will be applied to that area. And
Okay,
regarding this,
sounds good. Yeah, sounds
okay,
good.
that okay, that's fine. Another option is the radiotherapy, in which the high dose radiation beams will be given to destroy these cells. For further discussion will be done by the specialist.
Okay, okay, okay.
Okay, so do you want to discuss a surgery, or may I go ahead with the further follow up?
Uh, s- Surgery, I am not keen, but okay, you can just discuss with me.
May I know the why you don't want the surgery?
I told you it's such a sensitive area.
Mm-hmm. Okay, that's fine. Okay, so it is very important to go ahead with the follow up. because follow-up is very important. There's a chances of coming back. So we advise you to follow up 3 monthly in the first 2 years, then yearly follow-up will be done. But if at any time you feel that there is any lump or the raised area and any change in your weight and appetite, you need to contact us immediately. I will give you the contact details as well.
Okay, thank you, doctor.
I will put you in touch with the counselors because coping with this situation can be difficult for you. If I will put you in touch with the counselors support group where you can meet the people having the similar situation. Would that be okay for you?
Okay.
Okay. So I will also give you the written information, document our consultation, and also write back to your GP about our agreed plan. And
That's
if you
okay.
wish, we will arrange the appointment with your partner as well. Thank you.
Thank you, doctor. Okay, so 40 seconds of excess, 40 second. Otherwise, could able to manage most of the points within your stipulated time. Okay. So your own reflection, then we will ask anybody has faced this station anytime?
Ma'am, last time it came, but it was not on my day. It was the second day of the
No, no,
exam.
that no, this has come up a bit up till now. This has come up repeatedly. So anybody has
Okay.
faced up this station. This has come up repeatedly. Don't worry. I know that. Okay. Uh, so your own reflection.
Uh, I don't know, ma'am. Maybe.
Okay. So you think that you had covered most of the points. Only 40-second max is little bit extra. What you
Ma'am,
needed.
maybe she was not satisfied with the surgery. So at this point, I didn't convince her. So maybe some points are lacking in behind that. Maybe in my explanation
Yeah,
because she was.
okay, that is good. Yeah, that is good because surgery, you yourself told that it is a
It's a
recommended line of.
recommended one.
Yeah,
But she didn't want to hear
yeah.
about that.
So no, no,
So.
no. So it is always better if whatever she wanted to listen, give that option first, and then come to the option what you wanted to go ahead. Okay, surgery.
Mm,
Yes, definitely you need to explain her what are the pros and what are the cons associated with surgery that need to
mm.
be explained to this patient. Okay, even
So,
even if she
doctor, how
doesn't.
we can deal that if she don't want to hear that?
It's okay. Means, yeah. So, she will not accept it at negotiation task. Always remember that whenever the you want to negotiate with the patient's task, always explain what patient want first. Okay.
Mm,
The
mm,
advantage of that method. Okay. Okay. It avoids the surgery, the surgery associated risk associated with surgery, pain, infection. But this is not a recommended method because it is associated with high risk of recurrence. Sometimes there might be a risk of hidden cancer below this lesion. We need to know, and for that we may not be able to get a sample unless and until we will not uh, be doubly sure that there isn't any hidden cancer. This will not be an
mm,
option. The option This will not be an option. The option or the recommended line of management is surgery, where we can go ahead with a wide local excision or a simple
mm,
valvectomy. If there are multiple lesions, yes, simple valvectomy will be a extensive surgery. Then
okay.
additionally, you will be getting samples for a detailed examination. We will get a clear picture what exactly it is, and even after the surgery still there is a possibility of this lesions coming up. Okay,
Mm-hmm.
so at that time we can always have this alternative available with us, either a cream, that is a mucomoid cream, or a radiotherapy, something like that we can say there. Okay,
Okay.
anybody wanted to say anything about this conversation?
Ma'am,
Anybody?
ma'am, I
Hmm.
have
Ma'am,
one thing.
in information gathering, do we have to ask her any breast lumps because Paget somewhere else also we
She
should.
has asked me regarding, no, she has arranged a mammogram, but she has not mentioned, so she can explain that at least. Okay, have you means self screening, okay?
Okay.
But it means have you had or examination of breast can be offered to the patient.
Okay, ma'am, in the explanation, we can say that it is a condition in which there can be a hidden cancer, underlying
Yes, yes,
cancer,
that I
and
wanted to
also,
mention.
yes,
Yeah,
ma'am,
that I wanted to mention. That is the
hidden
point.
cancer, or it can be a lesion because of cancer somewhere else also might be there.
No,
Like
she
that, we
mentioned
can.
about that CT scan on colonoscopy, all those points she has mentioned. She mentioned about sampling of lymph node also, but why she wanted to do this, she has not mentioned. She missed out on that. So it is patient safety.
Ma'am, I
Ma'am, one
mentioned
more.
that it can be associated with the underlying cancers of the bowel, water pipe, so we need to investigate it. I
Okay,
mentioned
that
this
way you
point.
mentioned. Yeah, yeah, that way you mentioned it. Yeah,
Okay,
that way you mentioned it. Huh. But she yeah, she mentioned it that way. Yes, yes, agreed.
Ma'am, one question I was asking, like this Paget's disease has developed on the background of lichen sclerosis.
Yeah, she
So,
missed out totally.
huh? Sorry.
She missed out totally on lichen sclerosis.
Yes, so we need to tell those points. And as far as my knowledge, I'm not sure. Um, when there is a lichen sclerosis on the background, then as it is, surgery is not the preferred mode of treatment.
No, who said this?
I means I know surgery uh because in lichen sclerosis they say that we should not scratch it, and that is what I know. So I'm not
No,
sure.
so for lichen sclerosis, you are going to give her a potent steroid.
Yes, that is correct.
Yeah, that is correct. But if there is any obvious lesion, then Paget's surgery, the same way that VIN with lichen sclerosis comes up.
Okay.
Okay, for
Okay,
that
ma'am.
lichen sclerosis, the treatment of Lyme will be vulval care and potent steroid. Okay, so clobetasol propionate 0.05%. How to apply that also you have to explain to the patient in one line.
Okay.
Hmm?
Okay,
Mm,
ma'am.
okay, so see, whatever, if the patient doesn't accept surgical line of management, you are not going to force her, but you are just going to tell her pros and cons of all the options, along with this potent steroid, what she needs to do, and vulval care, what she has mentioned. I was not keen on vulval care, means I know about the vulval care, so I don't want you to explain me in detail about vulval care because that is a time consuming.
Okay, ma'am, I got your point. Thank you, ma'am. Yeah.
Okay, so I do not want you to spend so much time on that explaining me what exactly the vulval care means because they want you to. They also know that this is a lengthy station, so you should be explaining me regarding the points. What are there? Okay. Anybody wanted to say anything else?
Dr. Prajata, when you mentioned that already the biopsy was taken, so we can say because at that time I didn't make myself correct, so like we can say that only the small sample was taken, but we need to see for any hidden areas or affected area will be removed. So in
No,
that
not
situation,
necessary.
surgery.
Not necessary. Not necessary. Because see, biopsy purpose of biopsy is only that only, just to identify the cause. Okay.
Cause
Now
yes.
you're yeah. So the sequence of event in this case will be the first will be it will be diagnosis, means
Mm-hmm.
biopsy where we are going to diagnose the condition. Then the depending upon that biopsy, we are going to schedule means create a safe plan for her. So it will be as rightly said MDT. It will be vulval MDT, dear. Huh?
Yes, ma'am. Yeah.
Yeah. So say what MDT? It will not be onco MDT. It will be vulval MDT, where the dermatologist will be a part of this MDT. Who treats Paget's? It's not colorectal surgeon. It's dermat. If it is not the colon or the bladder involved with this condition, then you do not need to involve the surgeon. You just need to involve the vulval MDT people, which will be your gynecologist, tissue doctor,
Mm.
imaging doctor, dermatologist, GPs, nurse specialist. Okay. Counselor, yes, if
Yeah.
it is affecting her, then definitely a counselor. If it is not affecting her, you can skip this counselor. It's BBN.
Mm.
You had followed the template. Okay. Uh,
ma'am.
yes.
Ma'am, cancer specialist is not included in MDT, no? Then,
In vulval MDT, not immediately. This is not a cancer actually as of now. This
yeah,
is
ma'am. Yes.
vulval. Yeah, but our aim will be to rule out a hidden cancer. Our aim will be to rule out in hidden cancer. Still, it is at risk of what is the implication. Okay, so this is a that one point was there, dear. Okay, that also you need to mention that the implication of this condition. Yes, she can have a sexual difficulties because of this intense itching Explain implication of woman's condition. So she can have this intense itching which will affect her day to day activity and quality of life, sexual life. And the another thing will be uh, recurrence and the chances of it to have a cancer in future, or even the hidden cancer. So these are the implications which you have to explain here. Okay, so you ask
Okay, ma'am.
already everything, but then explain the implication why we are worried about this
Yeah.
situation. Okay, so
Yes,
these
I
four
got it.
points you have to note what exactly. Then establish and
Hmm.
answer patient's concerns. My concern is I'm not keen on surgery. I wanted to know other options. So that is one thing. Outline, justify
Hmm.
management plan. So the plan will be you are going to give her pros and cons of surgery. You are going to give her pros and cons of everything, and then then that MDT and 2 week pathway, vulval MDT and 2 week pathway will be the management plan where you are again going to investigate also that plan you had given me. Okay.
Okay. Yeah, ma'am. Thank you.
So one point very nicely you had mentioned about mammogram. Even you can ask about the breast self examination.
Examination. Yes.
Yeah.
Okay.
Okay. Difficult situation and treatment available. Whatever means what introduction of policy, setting agenda, aiming, everything was normal. Concerns you missed out there. See to it. You will ask something. Open question you asked me. This lichen sclerosis is associated with diabetes and thyroid. So if possible, you can ask them a specific history, bladder bowel symptoms, allergy you had asked. On any other site you had asked. Okay. Sexual signposting, strain on relationship you had asked. Quality of life you had asked. Red flags also you had asked. Smear was already given there. Menstrual history was
Yes,
already
ma'am.
given
Yeah,
there.
because the report
Yeah.
was, yeah, ma'am. Yeah.
Yeah, obstetric history, I told it because I don't want you to spend too much time on that. And social history, only smoking is important. No alcohol, no drugs and cocaine, okay? Because it's not going to affect her. And whether it is affecting her emotionally, because this is a long-standing cases, the patient might get emotional turmoil. So you do not need to ask those two questions. You can just ask her whether this itching is affecting her emotionally. Does she need any help? Hmm? Then only offer counselor, otherwise no. BBN checking understanding of report you forgot. Did you explain me? Did you ask me
Yes, I.
whether I'm aware about?
I
You
think
asked me about
initially I asked her
Paget's.
any idea about your report,
Okay,
so
in the
she.
beginning, yeah, okay, I must
Yeah.
have missed it. In the beginning, if you had asked it, okay. Then Paget's disease, you had mentioned. So Paget's disease is abnormal cells, not cancerous. But this sentence is very important. The chances of hidden cancer of vulva is very high. Abnormalities in all the layer of vulva with other reports showing lichen sclerosis. This lichen sclerosis also you have to explain that it is a chronic condition, immune system, our own body getting affected. Most of the time it is associated with diabetes and thyroid. So they wanted to combine two tasks at a time.
Okay, ma'am.
Okay, so LS it will be screening for thyroid and DM, not for M. It is DM. Okay, this is not for, this is DM, and thyroid will be offered for LS. Potent steroid for 3 months. How to fingertip of unit. Uh, Initially daily, alternate day, the next month, and the bi-weekly, the last month. Okay, as can be applied as per the instructions. Along with that, we will offer you patient information leaflet. So this actually they are having a very good leaflet regarding the application of this steroid and vulval care. Okay, management, now coming to the management implication in between, you have to explain her what are the implication. Even I had not mentioned. Okay, but implication is included in that case, so you have to explain her this means the implication of this condition. The next point will be implication. So the implication will be affecting her quality of life, affecting her sexual life. The risk of recurrence is there, and the risk of cancer is there. Okay, uh, even the cancer of somewhere else also there. Vulval care, do you want to discuss? No, I don't want to discuss. I'm aware. uh, One sentence, line you can still use, or you can skip it completely. That might consume your time. Paget's disease, slow growing disease, that is pre-invasive form of skin cancer. Okay, so it is not cancer, but it is pre-invasive. It is a precancerous lesion. It looks similar to patch of eczema and usually affects skin in the genital area around the anus. Commonest over the age of 50, peaks around at 65 year. If you want to explain her in detail, but it is okay, what exactly it is you need to know. Vulval MDT 2 week pathway, specialty clinic, colposcopist, gynecologist, dermatologist, GP and specialist nurse. Here not only you have to rule out that colonoscopy or cystoscopy, you have to under do the colposcopy also. Hmm? Uh, we will offer you yearly follow-up. Ask you nurse specialist to check on it. Self-examination frequently to see any changes in abnormality. Reports us immediately. So this follow-up plan you had given me. I have not come across how frequently you need to follow them. If you are having a very solid reason to follow her up very 3 monthly, you can give that plan. Okay, but whenever I used to collect the review of literature, follow up is important here. How frequently we do not know. Treatment involved tests to look for this may be required. Now treat this is basically that diabetes. Okay, so diabetes and thyroid. Okay, so self exam, no, this is not. So treatment involves tests to look for the hidden cancer. This is actually what I wanted to say you. The test to look for the hidden cancer is needed. This will include blood test, ultrasonography, CT scan or MRI. In some cases, biopsies of other parts of the body like lymph glands, you had mentioned very nicely, and colposcopy, anoscopy, cystoscopy, or the camera test to look for any cancerous lesion or precancerous lesion. And choice of treatment is, or the recommended line of treatment is to remove the area either widely if there is a single lesion, or if there are multiple lesions, then a simple vulvectomy can be offered to her. However, recurrence is very frequent, which you had mentioned when you were explaining me the modality of treatment. Surgery, how you need to go ahead. That means at least we need to have a clear margin of 1.5 to 2 centimeter from the visible problem. Pros and cons of surgery, you have to explain her. If it is a wide local excision, it's a small surgery, but still the risk of anesthesia will be there. But if it is a simple vulvectomy, then it will be an extensive surgery where infection, bleeding, scarring of the vulva will be the risk associated with this surgery. But the benefit of this, we will have that cleared margin of the lesion. Most of the time we will have a complete removal of the lesion, but in spite of surgery, chances of recurrence are there. If surgery is not a feasible option, then alternatives like imiquoid cream, which encourages immune systems to destroy the abnormal cells, laser, or from a light treatment, that is photodynamic therapy, what you had mentioned, we need to apply certain chems and then laser, or a radiotherapy. These are an alternative treatment options, specially offered to the patients those who are elderly and not fit for surgery, or they can be used in combination after with the surgery to treat the recurrence. If keen on non-surgical, ask why. Because I was very clear why I do not wanted. That part has been completely taken care. The summarize treatment option, if she wants to discuss regarding the, means if you can have a time, you can just summarize. So what you are having, what options we are having: wide local excision, skinning, vulvectomy, laser ablation, or topical treatment or radiotherapy. Any sexual difficulties, once the lesions will heal after the use of steroid, she can start here. She can take a help of psychosexual counselor also, partner also, so they can be offered to her. Now give her a patient information leaflet regarding. You have to be very specific whenever I am explaining you. You have to be very specific to offer her patient information leaflet of that specific condition: vulvar care, PIL of lichen sclerosis, and extra mammary Paget disease. Refer. Now our plan will be refer to colpo anocysto, right back to the GP, follow up appointment, clobetasol propionate, referral to dermatologist. That MDT, yes, we are going to refer to the MDT 2 weeks pathway. Documentation and NLSSG, that is National Lichen Sclerosis Support Group, and British Association of Dermatologists, that is BAD. So these two groups are having a support group. Okay, so they will act as a support group for this patient. So overall, you had
Dr. Bachata, if
done.
in the exam we don't remember the support group's name, so just if you mention the name, is it fine?
Yeah, support group regarding lichen sclerosis. I would like to offer support group regarding. So that's the reason this preparation starts from very early. Means what we can do now, write it down the support group of particular condition and just make a proper chart. Okay. And the
Okay.
day before exam, you just need to brush up whatever support group. But from the very
Okay.
beginning, if you are involving those support group in your practice, less likely you will be failing.
Yeah,
Okay,
I
or you
think.
will not be
Thank you,
remembering.
ma'am. Yeah, thank you so much.
So overall, a nice presentation. Lichen sclerosis. I feel that this task has come up with Paget's with lichen sclerosis. What I know or what I gathered from the previous attempt. Okay, so Paget's with lichen
Okay, ma'am.
sclerosis.
So, ma'am,
Okay, ma'am. Thank you. Yeah.
sorry,
Hmm.
I have one question. If patient don't want surgery, then we will explain all these things and we will start the clobetasol. But if patient wants surgery, so the first line treatment is surgery.
Hmm.
So for lichen sclerosis, we should